Hi, Erin. I'm Lacey, and I'm going to be doing an oral mech exam on you today. How are you?
Good.
Okay, so before we get started, I need for you to fill out these really quick forms. The one on top is an informed consent form. It's just pretty much permission for me to videotape you today. And then the other one is just a permission to test form. So I'm going to hand these to you, and I'm going to give you a pen to fill those out. And then I'm going to get everything prepped for our exam. So before we get started, Erin, I'm just going to clean up our area. So I'll wait for you to fill that out really quick. I'm going to clean your mirror first. I'm going to go ahead and put some hand sanitizer on in my gloves. Okay, thank you, Erin. Okay. Just want to say thank you for coming in today. This is going to be very routine, and it shouldn't take that long. Pretty much what I'm going to do is I'm going to look at inside your mouth for a little bit. I'm going to look outside your mouth, and I'm going to view your different articulators. So I'm specifically going to be looking at your teeth, your tongue, your lips, and I'm also going to be looking at your jaw. I'm going to be checking your breathing as you're being examined. And then I'm going to also do a diadokinesis test, where I'm just basically listening to you say a certain sound or a certain sound combination to see how well you articulate it. So it's really easy, it's not painful, and it'll be really fast. So before we get started, today is April the 27th, 2014. So what is your birthday, Erin?
June 10th, 1987.
Okay, and so that will make you, I already have it down here, that's correct. That'll make you 26 years old in 10 months.
Yes.
Okay, perfect. Okay, so what I'm going to do, if you would just look at me, I'm going to look at how your lips look at rest. So just kind of model my mouth. So just kind of at rest. Good. Everything looks symmetrical. Okay. And then now I'm going to have you, I'll either direct you, or if you need a prompt, I can prompt you with the tasks I need for you to do. So first I need to see how you round up your lips. So can you go, ooh, good. And now I need for you to draw your corners back like you're smiling really big. Good. Okay. And then next you're going to close your lips and you're going to puff out your cheeks. Very good. And then you're going to bite your lower lip for me. Very good. Okay, so next I'm going to take my flashlight. I'm going to just look at your tongue. So can you stick out your tongue for me? Good. Can you stick out your tongue kind of level for me? Go like this. Okay. Can you point up your tongue for me? Open up your mouth and kind of stick it behind your teeth for me. There you go. Okay, everything looks good there. So far you're doing wonderful. Okay, so we're going to do some non-speech motor tasks with your tongue now. So can you point the tip of your tongue up? Good. Can you point your tip of your tongue down? Very good. Can you do it to this side and then your other side? Good. Okay. So you did up, down, left, and right. So now, you know how whenever you get peanut butter on the top of your mouth and you just have to get it off with your tongue, that's the only way it's going to come off. So can you show me how you move your tongue back, but open up your mouth a little bit for me? Good. Very good movement. Okay. So now I'm going to look at your teeth. So I'm actually going to get inside your mouth now, but it's going to be really painless. I'm going to take this cotton swab just to help me count your teeth. And I'm just going to look at how your first molar, which is your fifth teeth, on the top and the bottom, how they line up with your alignment to see if you have any deviations with it. Okay? So if you can open up your mouth for me, and I'm going to count your teeth. Okay, can you bite down for me? Okay, now check your other side. Okay, let me count your teeth, make sure they're right.
Okay, can you bite down for me?
Perfect. You have good alignment. Okay, I'm going to draw out your teeth. I didn't see anything abnormal with the relationship, so that's great. So you have perfect occlusion. Okay, so on your next one, I'm going to look at your central incisors, okay? So can you just, these are your two front teeth, and I'm just going to see how they relate to each other. So can you bite normal? Okay. Has your dentist ever mentioned anything about an open bite whenever you've visited them in the past? Okay. So I'm seeing that today, so that hasn't changed. So I'm going to mark that, but good to know that that's consistent with what your dentist has said in the past. Okay. So next, I'm just going to look at the general condition of your teeth. Okay, so I'm probably going to stand up so I can get a little bit better of a view. Okay, if you could just open up your mouth, I'm going to check for any cavities or decay or anything like that. Okay. Get my cotton swab. Okay. Everything looks really good. I can tell that you've been taking really good care of your teeth. And I don't see any cavities or, let me check your mouth again. I did see a few gaps where you're missing teeth. So you're missing your second molar, and you've had your wisdom teeth removed in the past. Okay. And then that's all I really see that's missing. Okay. So let me just draw that really quick. Okay. Okay. Okay, and I don't see that your teeth are excessively crooked or anything, so you've had braces in the past?
Yes.
So it seems like they've really done their job, so they look really good. And it looks like you have good overall oral health. I did notice a little bit of redness on your gums. Is that, you had mentioned earlier in your intake form that you had had a gum graft done. So it's still a little bit red, so it's still healing?
Yes.
Okay, what has your dentist said about that? Does he think it's going normally, the recovery process?
Yes, I'll
Okay.
go back in a month and I'll be good.
Okay, perfect. We'll just keep brushing your teeth and doing all the protocol. It seems to be really working well. Okay. So next I'm going to look at your hard palate. It's just the top part of your mouth. So I'm just going to shine my light there and just look, okay? So if you could open up your mouth for me. Okay. It looks like it has great height and great width. Okay. Everything looks good there. Okay, so I'm going to look at your soft palate. So I'm just going to take my tongue depressor and I'm going to look at your uvula and just how your general soft palate looks, okay? I'll try not to gag you, which hopefully that won't be an issue. So just go and open up your mouth for me. Okay. Say ah.
Ah.
Good. Say ah again. Ah. Ah. Okay, you can rest it. Say ah one more time. Ready? Ah. Okay. Everything looks wonderful. Okay, so it's very symmetrical. Your uvula looks normal. You have very good movement and symmetry on all three trials of the ah, so that's very good. And then you also have your anterior fossil pillars, your posterior fossil pillars, and your palatine tonsils. Those haven't been removed yet. They look like they're in good health, so they don't look like they're needing any checkups or anything. They look good right now. Okay, so what I'm going to do now is I'm going to check and see your veloopharyngeal mechanism, which is basically I'm going to check and see while you're saying ooh, if any air is coming out or if there's any change. Just to monitor if your air is coming out of your nasal cavity correctly. So what I'm going to do, I'm going to use, and I've already wiped this down for you, I'm going to use this and hold it underneath your nose, and then if any air comes out, we'll be able to know. Okay? So it's really easy. It's not painful. So what I'm going to do, I'm going to have you say ooh, and you're just going to keep saying it until I tell you to stop. I'm just going to pinch your nose and hold this under, okay? Are you ready? Okay, you can begin. Say ooh. Perfect. I didn't see anything wrong, so that's great. Okay, and Aaron, you're not a mouth breather, so that's very good. Okay, so now everything's done. I'm going to take off my gloves. I'm going to put a little bit of antibacterial on. Do you need a tissue or anything for your mouth?
No.
Okay. Okay, so what I'm going to do now is I'm going to have you say certain sounds, and I'm going to see how you articulate them and if they're rhythmic whenever you say them. Okay, so this is the diadokinesis part. It's the last part, so after this you're all finished. So what you're going to do, we'll just talk through the sounds first, and then we'll actually practice it. So first you're going to say puh. So can you do that with me?
Puh.
Good, puh. So you're going to say that 16 times, okay? And then can you say tuh for me?
Tuh.
Good. You're going to say that 16 times too. I'll help you, remind you. And then you're going to say kuh.
Cuh.
Good. So you're going to do that 16 times. And then you're going to say putta.
Putta.
Good. You're going to say that 12 times. And then you're going to say puttica.
Puttica.
Okay. And then we can practice each of them just so you can know which one that we're on at a certain point. Okay. So I'm going to take my stopwatch. Okay. And I'll count you off, okay? And I'll tell you whenever to start. And I'll count, and you can count as well if you want to, so you can keep track. And I'll just tell you when to stop. Okay, ready? So we're going to say puh. So are you ready? Do you need to practice the sound or anything? Okay. So 1, 2, 3, go.
Puh, 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 puh.
Good. Okay. Everything sounded rhythmic, and it was articulated correctly, so that's wonderful. Okay, so now we're going to do tuh. Do you need to practice? Okay, so I'll just count you off then, and I'll count, or you can count as well. Okay, ready, set, go.
Tuh, 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 tuh.
Good. Okay. And then that was rhythmic as well and articulated correctly, so that was good. Okay, so now we're going to do kuh. We're going to do that 16 times as well. Okay, ready, set, go.
Cuh, 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 cuh.
Good. Okay, everything was rhythmic and articulated correctly as well. Okay, so now we're going to say putta. Okay, do you need to practice first? Okay, so I'm going to reset you and then I'll count you off. We're just going to say that 12 times, so it's a little bit shorter. Okay, ready, set, go.
Putta, 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 putta.
Good. Everything was rhythmic with that as well and articulated correctly, so you're doing awesome at your diadokinesis. Okay, so the last one is puttica, and then you're all finished. Okay? Do you need to practice that one? That one's a little bit harder. You good? Okay. So I'll count you off. Ready, set, go.
Puttica, 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 puttica.
Good. That was your fastest. That was really good. And it was very rhythmic, and it was articulated correctly. So, Aaron, as far as I can tell, I'll write up your official report, and I'll give it to you in a little bit. From what I can tell, everything looks fine. Your lips, they look functionally, and they function correctly. You did all of your tasks correctly with your lips, so that means you have good coordination with your labial structures. And then with the tongue, your surface, your frenulum, everything was right with that. So that means that you should be able to articulate your sounds correctly. There's nothing that's a deviation that would affect you in doing that. And then you also did your up-down, your right, your left, and you're moving your tongue from your front of your mouth to the back palate. You did that fine, so you have good coordination with that, so that's wonderful. Your jaw, I didn't notice anything deviated with your occlusion where your teeth match up. So everything looks good with that. You don't have any malocclusions or anything, so everything's good. And then with your incisors, your bite just opens a little bit. So, but your dentist knows about that. So just keep monitoring that with them, and then just keep telling them if there's any deviations with that. And then the overall condition looks good. I didn't see any cavities. I didn't see any decay. You have a couple missing teeth, but your dentist knows about that. It's not anything new. And your alignment looks good. So it seems like your braces did their job and that they aligned them correctly. And then your hard palate, your soft palate, and your pharynx, they all look structurally normal. So there's nothing that's deviating that should affect use of those articulation points. And then your breathing is good. Your velopharyngeal mechanism, nasal sealing is good. So that's great. Your breathing is awesome. Once again, your diadokinesis everything was very rhythmic and articulated correctly. So as far as I can tell, there's nothing wrong with your oral structures, so everything seems awesome. So thank you, Erin, for coming in today. And like I said, I'll get this form to you in just a little bit.
Thank you.